as our final report. So first, let me introduce myself and the BC Society of Transition Houses, as well as the team. So my name is Tanis Knowles. I'm the project manager for the Getting Home project. I work with the BC Society of Transition Houses, which is a member-based provincial umbrella organization. We support anti-violence workers, providing support services and programs for women, children, and youth experiencing violence. We currently have 105 members, and we support over 120 housing programs and 86 peace programs throughout British Columbia. And peace stands for prevention, education, advocacy, counseling, and empowerment for children who previously witnessed abuse. So this is, I'll tell you more about BCSTH and our partnerships throughout this project, but just give you a sense of who we are and who I am. This project wouldn't have been possible, and the outcomes of this project, without some of our key Getting Home project team members. Kayla Ashley, whose picture you can see here, is currently a master's student at the School of Public Policy at SFU, and Kayla was the lead author of the Getting Home project report. Alina McKay is a postdoctoral researcher at UBC, and her research focuses on understanding the links between urban density and well-being. And finally, Ghazaleh Akbarnejad is an architect who's currently doing a master's in urban studies at SFU, and also worked on some of the pieces of this project. As well, it's important for me to, when we're talking about housing and homelessness, it's important for me to acknowledge the land which we are on. The BC Society of Transition Houses is located on the unceded territory of the Coast Salish people, shared by the Squamish, Musqueam, and Tsleil-Waututh nations. As this work addresses barriers to safe and affordable and appropriate housing after violence experienced by women throughout this province, we recognize that this discussion includes all 203 First Nations throughout BC. We understand that the displacement of Indigenous people from their lands and other ongoing effects of colonialism are foundational to the disproportionate number of Indigenous women and girls experiencing homelessness and violence. As such, in order to fully address homelessness and violence, we want to recognize the important systemic changes that are needed at many levels around this issue. And I would like to offer my gratitude to be able to do this work on the beautiful lands that I live and that work on. So I just want to give you an overview of the presentation and what we're going to do today. There's lots to cover, and I encourage you to explore the project and the report on our website. But we're going to explore the final report of the Getting Home project. I hope that you'll gain a better understanding of the successful outcomes of this project and an opportunity to reflect on the findings of the innovative research that we conducted to hear the voices of women experiencing housing barriers in this province, and learn about the next steps as we build on the project's findings and partnerships. So we're going to do all that in an hour and a half. So, as I mentioned, BC Society of Transition Houses So the BC Society of Transition Houses is a member-based provincial umbrella organization, and we support the anti-violence sector. Who we support, as I mentioned, we support transition houses, second stage houses, third stage houses. Sorry, I don't know why it keeps going ahead like that. Third stage houses, safe homes, and peace programs, and violence is preventable programs throughout the province. We support over 120 housing programs and 86 peace programs throughout BC. And we do this through developing and delivering training, including an annual training forum that we had in October. We produce reports on legal issues, policy analysis, and practice guidelines, which you can find on our website. We keep members up to date on emerging provincial, national, international issues. We advocate on behalf of our membership to the government and other stakeholders, and we provide a free library of resources for our members as well. So that's a little bit about us. What I want to do now is hear about who's in the room. So if you can tell us a little bit about where you're coming from. I know that some of you may be multiple of these things. None of us just wear one hat these days, but if you would like to answer based on what you feel most like today, that would be great. I see the results coming in.
If Simone doesn't show, I might watch that, whatever that thing is with you.
Yeah, do you want me to forward it to you?
Sure. Register or anything?
Great. Okay, so it looks like we've got results coming in. So we've got a significant group of people from the transition house sector. That's fantastic. You know, for those of you from the transition house sector, I will be explaining a lot of things in this presentation that you probably already know very well and much better than me from your on the ground work. But I hope it will be informative to everyone else. And then we have community housing folks and researchers, policymakers. We have some funders in the audience. That's always great to hear. And women with lived experience of violence. And so this is great. And like I said, I imagine that each of you are multiple of these things, as we're doing many things these days in our work, but it's good to see who's in the room. So thank you so much for being here. Okay. So before I dig into the details of what we did in this project and what the outcomes and research showed, I just want to give you an overview. So the Getting Home project started in 2018. It's a community-based project focused on reducing barriers to safe, secure, and affordable housing for women fleeing violence. So the key point that I want to make here is that this project was really focused on the bottleneck that has been forming in the transition house sector, where women come into transition house or try to leave a violent situation and aren't able to find long-term affordable housing. So this project really tried to focus on what are the barriers and key solutions to that issue. We had 4 community projects across the province, which I will go into detail about later, but they were the heart of this project and really made us able to work on some of the key issues that we found in our community needs assessment. And the project has resulted in policy recommendations, several advisory committees. We have a series of reports on our website, which you can download, and other materials, including an infographic and a website with tips for housing providers that are interested in partnering on these issues. This project wouldn't have been possible or as successful as it was without our amazing partners. So we had a project steering committee with partners such as Community Co-op Housing Federation of BC, Van City Community Foundation, BC Nonprofit Housing, who's helping us host this event today, and BC Housing. This steering committee really helped to guide the way for this project and were generous in their support and network that made our partnerships really fruitful. And of course, we couldn't have done the work without the funding from Women and Gender Equality Canada that funded this over 3-year project. So the report, I want to give you a sense of what to expect. I encourage you to find it on our website. You can download it there as a PDF. It's very pretty to read and to look at. The report was published in October 2021, so just about a month ago. As I mentioned, the lead author was Kayla Ashley, who was a graduate student at SFU School of Public Policy. She did a fantastic job of highlighting the work of this project and the key findings of the research. The Getting Home project, like I said, it was a community-based project that focuses on reducing barriers to safe, secure, and affordable housing for women experiencing violence in BC. It began with a needs assessment in 2018 that informed the work of the project, and this report is now an overview of the project 3 years later, focusing on the 4 pilot projects that grew out of the needs assessment. While varied in scope and level of intervention, from providing frameworks for partnerships between transition houses and cooperatives, to developing structures for housing subsidies, to addressing issues of violence and housing, particularly in rural communities, and to pushing for changes to the national occupancy standards, these projects form a necessarily multi-pronged approach to the complex issue of housing availability and affordability. The report aims to serve as a snapshot of these projects at this moment in time, collecting key takeaways and overall lessons learned, as well as providing steps for implementation and frameworks for policy change in different settings. We really wanted the report to have multiple functions. It is a resource of research on the intersection of housing and anti-violence work. It's also an action guide for future work in this area. And we have several key policy recommendations that are included at the end of the report. Like I said, the report goes into detail about our research findings and the barriers to housing, but in the next couple of slides, I'm just going to give you an overview of the key findings and key themes and barriers. So we know that violence is the leading cause of homelessness for women. Research has identified that women are more likely to be part of the invisible population of those experiencing homelessness. Often in relation to issues of personal safety, many women shelter in the homes of friends or family or in their vehicles instead of accessing formal shelter services or living on the street. Women are often not defined as homeless when forced to leave their homes due to violence and are instead categorized as victims of domestic violence. And if you're interested in more research on women's homelessness, the Women's Housing and Homelessness National Network, led by Caitlin Swan, the research by Caitlin Swan is a really great report that I recommend. And Courtney, if you can put that link in the chat, that would be great. That report just came out in September. A significant burden on the capacity of shelters and transition houses is the ability to transition women into permanent housing due to the lack of affordable and appropriate housing in their surrounding communities. The lack of housing options often causes service providers to extend the length of stay of their residents to allow them to find more time to find permanent housing, and in turn decreases the overall availability of shelter space for women. The lack of women-specific spaces is problematic as women experiencing violence and homelessness in unique ways are often at higher risk of violence when accessing co-ed shelters and emergency shelter services. So as you can see, our key findings were that there was a relationship between violence and women's homelessness, but also important to notice is that in our research, we found that service providers revealed a real sense of hopelessness around this situation and that they are spending more and more time working on housing issues rather than working on anti-violence issues because it's so foundational to accessing safe shelter for the women they serve. We also found that women often have to choose between safety and housing and may stay in unsafe situations because they have no other option for housing. As a result, one of the key themes was that there's a need for long-term structural change as well as immediate increase to access to housing, and that this change needs to happen at every level, which you'll see as I talk about the pilot projects and how they operated at multiple levels. Now to the key barriers. The report goes into detail on all of these barriers, but I want to take a little bit of time here to talk about the key barriers that we found through our research. And this came out of the community needs assessment, which we did in 2018 and published in 2019, as well as the ongoing research throughout the course of the project. So it will be no surprise to folks that one of the key barriers was housing affordability. We saw repeatedly through our research that the key need is for more affordable housing options for women and their children. In 2019, BCSTH conducted a survey of its members, and nearly all respondents reported housing affordability as a barrier for women experiencing violence. It was clear from our research that affordability needs to be a priority for action to be taken for the rest of the barriers to be meaningful. One focus group participant said, "Even if we find solutions to the other barriers, if there's no affordable housing for women to move into, it doesn't matter." And I think that sums up how foundational the affordability crisis and access to affordable housing is to this issue. Certainly, the issue of barriers to housing for women experiencing violence does not exist in isolation. A larger shift towards ensuring affordability for all communities in BC needs to be paramount. When we asked how affordability was impacting their work, our members reported that the main issue that women were facing was staying in transition houses and second stage housing longer, which, as I mentioned, creates a bottleneck. Another priority issue was the amount of staff time that was taken up on housing concerns. Although we didn't ask these questions directly, approximately 20% of survey respondents spontaneously commented that the housing crisis was leading women to find unsafe housing, and that many of those interviewed and folks in the focus groups talked about workers feeling worried about women returning to their abuser due to no other housing options. So what about poverty and financial barriers? This was another key barrier that we found. Our research showed that many of our members and women were concerned with chronic poverty and the ability to get ahead. The low wages women were able to get paid, the rates of income assistance, and the affordability crisis were all topics that surfaced in the survey, focus groups, and interviews that were conducted. It was clear that even the traditional affordability benchmark of no more than 1/3 of your income be spent on housing and utilities no longer seemed to be an attainable ratio, which will be no surprise to folks listening to this today. We got some data from Statistics Canada from our wonderful partner, BC and PHA, and I think this really sheds light on the issue. 64% of households led by single mothers, are spending over 1/3 of their income on housing, and 32% of single mother households are spending more than 50% of their income on housing. So outside of systemic poverty issues and chronic poverty, there's also there's some specific financial barriers, and one example of that is the cost of moving. The cost of moving and starting a new household surfaces a major financial barrier for women in obtaining long-term housing. 45% of respondents reported that these barriers were a top priority for women's access to housing. From our qualitative research and survey comments, we know that these costs include damage and pet deposits, first month's rent, co-op member shares, new furniture, and day of moving costs. So that's a key example of one of the financial barriers that women face at the very beginning of trying to find housing. And what about discrimination? So this was a key issue that women found that they were facing in the housing market, most often in the private rental market. Nearly half of our survey respondents identified that discrimination was a key barrier to access housing in the private rental market. And this was compared to 5% in terms of social housing, which is important to note, although because the waiting lists are so long, especially for large families in social housing, many women are looking at the private market as an option for rental. So this issue of discrimination is very relevant. Qualitative research from the community needs assessment with co-op members with lived experience of violence identified that within the co-op housing, there was a stigmatization of women fleeing violence and concerns about violent incidents occurring in their community as a result of having women fleeing violence there. Related to this issue of discrimination is the importance of the lack of pet-friendly housing. And our survey found that 85% of respondents felt that pets were a barrier to accessing housing in the private market, as well as a top barrier in the social housing market. The total impact of the lack of pet-friendly services and how it is a barrier to accessing both services and permanent housing requires further research. And then accessibility and appropriateness of housing and services. So it's not just about the affordability of housing, although that is key. Finding appropriate housing is also a barrier. Even within social housing, there are a number of barriers that prevent women from securing appropriate permanent housing. I just lost my train of thought here. Because of the lack of affordable housing in the private market, there's a high demand for social housing, which causes lengthy wait lists that leave women on with no option between transition house and waiting for subsidized permanent housing. In addition to the lengthy waiting list, respondents to the Getting Home Project survey indicated that the lack of knowledge and understanding was an issue. Many women using services felt that more knowledge of the barriers to housing was important. More knowledge of the BC housing process and community housing providers also understanding the issue about access to housing. Finally, I want to note some information that came out of our focus groups. So the focus groups were extremely valuable aspect of this research. We were able to conduct many focus groups that included groups of women with lived experience of violence, women living in co-ops, anti-violence workers, and transition house staff. These focus group conversations assisted the project in shedding light on the major barriers to housing, as well as provided nuance and context to much of the academic and quantitative findings that we were gathering. The conversation about supports and services from transition house staff stood out in our focus group with women with lived experience as an important aspect in their success in their ability to find and maintain housing. Women commented on the value of having knowledgeable advocates beside them as guides through the search for housing, accessing income assistance, and referrals to other services. So, despite the hopelessness and difficulty of the work, we know that transition house workers and anti-violence workers across this province are showing up every day and helping to inform themselves and women experiencing violence about the processes that need to happen in order to access some of these services. So the ability to access these services and housing is incredibly important when they are available. So I know I rushed through a lot of information there. I really encourage you to read the report, both the community needs assessment and the final report. But I want you to take a moment to, in small breakout rooms, to share your thoughts about these key barriers that I shared about our research with each other. I'll give you 5 or 7 minutes to chat in small groups. And Courtney, if you can facilitate the breakout rooms at this point, that would be great.
Here you go, folks. You should get a pop-up to join a breakout room. Tana's, don't click yours. And then I'll play you back in a few minutes. Let us know if you have any questions when you go in.
I hope you had, we're back recording, so we didn't record your discussions. I hope you had good conversations in small groups, and I encourage you to put in the chat if there are key ideas or key topics that came up that you'd like to share with the rest of the group. Feel free to put that in the chat and everyone can communicate that way, and I'll keep presenting, but we'll have another breakout room later. So now I want to talk about the pilot sites in this project. The work that was done in the 4 pilot sites was really the heart of the Getting Home project, and was key in the partnerships that were formed and the ongoing work that is happening on these key issues. All of the pilot sites came out of the work that the research and key barriers that we found in our community needs assessment. Of course, we couldn't address every barrier that came out in the needs assessment, but we did try and focus on some of the key barriers. What you'll also see from the color coding as well as the label of grassroots, community, etc., is that, I mentioned earlier that we really found through our research that the approach to the solutions to housing for women experiencing violence needed to be structural, systemic changes, as well as immediate solutions. And so we recognized that the solutions to these complex issues need to happen at all levels of decision-making and policy-making. And so we have identified that our pilot sites have operated at different levels. So you can see from the color coding throughout the report that we highlight the grassroots, the community, the provincial, and the federal level projects that we worked on. A key objective of the Getting Home project was to enact policy change at multiple levels, and each policy pilot site reflects a different level of change and action that highlighted the need for change at every level of decision-making, as I mentioned. So I'll start with the Comox Valley Partnership. This is our grassroots pilot site. So BC Housing's Homelessness Prevention Program, known as HPP, was the focus of this pilot site. The Comox Valley Partnership is a grassroots initiative between the Comox Valley Transition Society and Comox Valley Community Foundation. The project developed from an identified need for long-term stability and funding for homelessness prevention programs. The goal of the Comox Valley Partnership was to increase the impact of the existing HPP, which Comox Valley Transition Society has funding from BC Housing to provide. So to increase that impact by securing more long-term funding and doubling the number of supplements available to women seeking housing after violence. So the fundraising goal of the Comox Valley Partnership is to raise $1 million for an agency fund. The interest generated from the money held in trust would provide additional supplements year after year. The outcomes of this project are long-term in nature, and the partnership will be ongoing to facilitate the administration of the agency fund. In addition to community-based fundraising, the Getting Home Project, BCSTH, and the Comox Valley Transition Society advocated for an increase in funding to the HPP program through submissions to the BC government during the budget consultations in 2019. So that was what we considered our grassroots pilot site. Our community pilot site was based in Vancouver, which was the Vancouver Co-op Partnership. The aim of the Vancouver Co-op Partnership was to create a relationship between the women's transition housing sector and the co-op housing community in BC, to increase opportunities for women to transition into co-op housing communities after experiencing violence. This partnership was led by the YWCA Metro Vancouver. And there are two key objectives of this pilot project: to create a long-term and formal pathway into cooperative housing for women experiencing violence, and to create a sustainable partnership between sectors that could act as a model for structural and operational change in other communities. As a result of this project, 4 families headed by women who have experienced violence have accessed housing in the cooperative housing since 2018. And to ensure the longevity of the referral committee that was created as a formal pathway, the YWCA will maintain oversight of this referral committee and have ongoing meetings and conversations with the co-op sector. The oversight of the Vancouver Housing Cooperative Partnership highlights the benefits that can come from sharing knowledge and the ability to develop a bridge between two sectors. If you're interested in the specific operational initiatives and changes that were put in place through the Getting Home project, the final report outlines them in detail and provides an appendix with several templates that can be used and adapted by other communities to implement similar partnerships. Next, I want to highlight our provincial level pilot site, which was the Rural Housing Advisory Committee. Access to housing is experienced differently throughout the province, with those living in rural and remote communities facing unique barriers to housing when compared to urban centers. However, much of the discourse on the affordable housing crisis is in relation to urban centers such as Vancouver. Although the attention given to Vancouver is warranted based on the conditions that many people face in terms of homelessness in this city, the focus has resulted in an exclusion of rural and remote voices in the housing discussion. The Rural Housing Advisory Committee came directly from an identified need in our community needs assessment that showed that there was a lack of conversation and research around the specific and unique needs of women experiencing violence and access to housing in remote communities. And this pilot site consisted of 6 representatives from across the province, all BCSTH members providing services in rural and remote communities. And so as a committee, we met for 2 years and focused on a lot of important issues, including transportation, access to affordable housing, relocation that is often required in remote communities, cell phone coverage, and then the limitations of the safe home model and access to transition houses, and then access to long-term housing. And so out of this Rural Housing Advisory Committee came research, which we've presented at conferences, as well as a variety of sub-projects that have continued to work on this issue. So I want to highlight this work, and I recommend finding out more about our specific deliverables of this part of the project on our website as well. And finally, our last project had to do with the national occupancy standards at the federal level, which we considered our federal level pilot site. So this brings me, before I go into that, I want to illustrate a little bit about what the national occupancy standards are, if you know about them or if you don't. The national occupancy standards are guidelines that CMHC uses to understand housing suitability and overcrowding in Canada. And they are also used by housing providers, sometimes used by housing providers as eligibility requirements to understand the number of bedrooms that a family would need in order to access housing. So the national occupancy standards, if you don't know, state that there's a maximum of 2 people per bedroom, but those 2 people can only share a bedroom if they are a married or common law couple, of the same gender, children of the same gender under the age of 18, or children of opposite genders under the age of 5. Everybody else requires their own bedroom. So if you're just learning about the national occupancy standards now, bear with me. If you already know them, then this is a test to see if you can evaluate whether or not how many bedrooms this family needs. So in this scenario, Rhonda is a single mother with 5 children. Her daughters Rosie and Molly are 19 and 6 years old. Her sons Mike, Sam, and Mark are all under 5 years old, and her mother recently moved in with them to help with childcare. How many bedrooms does Rhonda need to meet with the national occupancy standards requirement? 1, 2, 3, 4, 5, or 6 bedrooms? I'll give you a chance to answer. Okay, so we've got the results coming in here. So it looks like there's an overall understanding that she would need several bedrooms, at least 4, 5, or 6 bedrooms. For those of you who said 6, that is correct. So in this scenario, according to the national occupancy standards, Rhonda would need her own bedroom. Her daughter Rosie, who's over the age of 18, would need her own bedroom. Molly would end up having her own bedroom, or maybe sharing with, and then Mike, Sam, and Mark could share, 2 of them could share a room, and her mother would need her own room. So that adds up to 6 bedrooms that would be needed according to the national occupancy standards. But of course, we know that access to a 6-bedroom unit is potentially impossible and incredibly expensive. So thank you for the little trivia question here.
There was just there was a question from Charmaine about who enforces these standards.
Yeah, thank you. So the national occupancy standards are guidelines. They are not law, and they are guidelines by CMHC. They are sometimes used as operational policy by housing providers, and are sometimes enforced through the application processes of housing providers or landlords in determining the amount of bedrooms that a family would need. So this scenario that I put up is actually one that comes from our national occupancy standards study that Alina conducted. Alina, the researcher from UBC, actually went out and conducted interviews with women of lived experience of violence, as well as experience with the national occupancy standards as a barrier. And so she conducted 11 interviews to hear the voices of women, which is the first research that we've been able to find that actually asks women about their experience with spatial needs and access to housing based on these spatial requirements. So I just want to share her story. It's obviously we've changed her name for confidentiality, but I think it illustrates some of the key issues as well as the other interviews. And you can see more about that in the research published by Alina. So Rhonda was a mother of 5 when she first applied to move into subsidized housing. She was living in an abusive relationship and decided to leave. She had been on the waiting list for 5 years when she left her partner and was pregnant with her 6th child. One thing that is important to note is that it was really difficult to find spaces in shelters because transition houses and shelters weren't often able to accommodate the size of her family. The other thing is that Rhonda was required to stay within a geographical region due to a court order. So there were a number of barriers that made it difficult for her to find housing. Finally, a housing provider broke the national occupancy standards to allow her family to live in a 1-bedroom unit. And you can see from her quote here from the interview, "All I know is that if someone hadn't broken those rules, the national occupancy standards, I would certainly be dead, and my children would certainly not be okay. It begs the question, why does someone have to break the rules to save a life and a family, and this amount of poverty?" So Rhonda's story really speaks to the persistent role that the national occupancy standards play in marginalization and housing precarity of families, especially large families. But I want to let you know that, where Rhonda is now. Her family, which is now 10 people, live in a 3-bedroom house. They use a variety of different ways to make the space work for them, dividers and transitioning the space into various multiple use spaces. And her rent is subsidized by a nonprofit that helps her cover the rent in the private market. So that's sort of the human side of the national occupancy standards. As a pilot site, we worked on this through a working group of a variety of stakeholders that found that this issue was important across the province, and especially in urban centers without as many family housing units. So the research on the NOS included a policy analysis, as well as a rights-based and legal perspective on these standards. We did qualitative research interviewing with women with lived experience, and we started the conversation about design and architectural perspective in order to gain insights into alternatives to the current standards and housing development. So I've already mentioned what the national occupancy standards are. They're Canada-wide guidelines on the suitable number of bedrooms for an individual or family based on age and gender of each occupant of the house. The guidelines were introduced in the 1980s with the adoption of the Canada Housing Act. According to the NOS, 2 people can share a bedroom if they are married or common law, under the age of 18 and the same gender, or both under the age of 5 and any gender. All others should have their own bedroom. So I encourage, the problem that we found with the NOS is that it contributes to women not being able to access affordable housing, and that women with larger families are disproportionately impacted by policy. Although the purpose of the NOS is to prevent overcrowding in urban areas and improve health and wellness, Western ideals of well-being can impose unrealistic cultural expectations and betray a one-size-fits-all approach. And so, as I mentioned, we had a working group that worked on this. We produced several reports and research on this that you can find on our website. And we continue to work on design and architectural research to think about how we can come up with solutions to this issue. So now I will ask you to go into breakout rooms again. And I'd like you to, I've gone through 4 pilot sites with you. So I'm curious for you to share with each other which pilot sites resonate with you from the perspective of your community or your organization that you might be able to build on or implement in your own area. So Courtney, if you don't mind giving people 7 minutes again to go into their breakout rooms. Thank you. Are most people back now, Courtney?
Yes, everyone's back now.
Okay, great. Wonderful. Well, welcome back, everyone. I hope you had good discussions. It seemed like folks were hanging on right till the end of the breakout room. So hopefully it meant that you're having fruitful discussions. I'm interested to hear from folks if anyone wants to share about their conversations in their breakout rooms, about what they talked about or discussed. If you want to, feel free to take yourself off mute and let us know vocally what you talked about. Or you can put things in the chat and share with the group that way. So I'll just give folks a moment to think about if there's anything that they'd like to share. I'd love to hear about your conversations.
I think I just would mention that in our group, it's more of a question than a topic. What we were, I guess, focused on was with respect to the guidelines of how many rooms you can have, how much of that is a rule versus a guideline or a suggestion. And one of the folks in the group had mentioned, well, what happens if a family with 6 children are in a 2-bedroom apartment, and is that something that would be regulated, or or do families choose for themselves what would be most appropriate based upon what's available? So I hope the group doesn't mind my mentioning that, but it would be interesting about that.
Yeah, thank you, Kathleen. Nice to see you. Thank you for that question, and I can clarify a little bit more. So to give folks context, the National Occupancy Standards are not a law, and they are not a rule or regulation. They are guidelines by CMHC that are designed as research measures for overcrowding and suitable housing and core housing need. That said, they have been implemented by some housing providers in BC and across Canada as operational policy for how they determine eligibility for units. And so on an application form, it may require that you say how many children you have, and then they would use national occupancy standards to determine the eligibility of that family for access. So one of the complaints we heard in the interviews that Elena conducted was that women didn't have an opportunity on the application forms often to say, I have 4 children, but we would be comfortable living in a 2-bedroom apartment. That was already determined for them. So no, there isn't an opportunity generally for folks to express their own ideas about how space should be used and how they would like to live in space. And that's part of the reason that we're conducting this research, is to shed more light on the voices of women who are actually living in these experiences to understand. We also know from housing providers that the national occupancy standards play an important role, although they may be more punitive than we've seen in other countries or in other places in Canada. It is important that people have space. And so if somebody, in Rhonda's case, she was living in a 1-bedroom apartment with 5 children, that's not sustainable. And we know that for health and safety and well-being, that is an overcrowding situation. And by no means are we promoting that should be the case. It may in the short term be an opportunity for safety, but we need to commit to providing adequate spaces and appropriate spaces for women and their children, and that don't disproportionately disadvantage large families. So that's part of the research that we're continuing to do on this, is to find out what that means. What is appropriate and suitable housing for families? outside of this very generic and culturally imbued idea of 2 people per bedroom that needs to be updated and thought about a little bit more critically in our society. It's from the 1980s, so it is definitely time to update them and think about them from different perspectives. So that's, and somebody mentioned in the chat MCFD. We've also heard reports that MCFD sometimes uses the national occupancy standards as a way of regulating their clients. And so that is also problematic, as they're not something that are a concern of safety necessarily. So are there any other questions or comments about the national occupancy standards or about what you talked about in your groups?
The
Our
second,
group,
oh, I'm sorry. The second part of that was just what happens if if the children are getting older and they exit the age that would be considered by the policy to be appropriate to share a bedroom. Would they be required to move, or what would happen in that situation?
Sorry, can you say that again?
Sorry. What happens in the situation when people are living in the accommodations at what's considered an appropriate number of rooms, but then the children get older and no longer considered of age to share a bedroom, so they would need more space under that guideline? What happens at that point under current situation?
That is an issue, and part of the reason that we're looking at the design elements, if we can have spaces that are adaptable throughout the life of a family as they change in age, and children move out, or more children are added to the family. But the actual answer to your question is that it would depend on the housing provider. There are some housing providers have policies where they require that if the composition of a family changes, that they would go on the waiting list for the next suitable unit that would be available, and that they could stay in their unit for the time that they are waiting, which could be a very long time depending on what kind of unit they need. Other housing providers have different policies around that. There isn't a blanket policy for this. It's a lot of discretion on the part of housing providers to decide what happens in that situation. I think somebody else took their microphone off for a moment. I don't know if they wanted to share something else or if I answered their questions.
yeah, I was just going to share our group quickly. We talked about the HPP program and some of the benefits of it, but some of the limitations in that there needs to be like a sustainability plan. I gather there's some flexibility in how it's implemented across the province, but some, like I don't know how strict some HPP programs are around being minimally at least employed or be employable in order to like be able to cover the full rent by the end of the year. But it's obviously a good program and a good response, but what our discussion inevitably came to was more realistic, accessible, long-term housing options.
Yeah, thank you for that, Jana. Nice to see you. Jana was one of the members of the Rural Housing Advisory Committee, and wonderful to have you here today. Yes, and for those of you who don't know, or I can remind what the HPP program is. So it's a homelessness prevention program, which is a subsidy for rent in the private housing market for women who aren't able to get into subsidized housing. So it subsidizes their rent for up to a year. But you bring up a very good point. Your group brought up a very good point that the cost of housing is not keeping up with that subsidy. And so although somebody may be able to access housing with that subsidy for that year, they don't magically become in a situation where it's more affordable because wages are low and income assistance is low, and there are a lot of financial and poverty issues that make it the case that someone may be in housing precarity when they're no longer able to access that supplement anymore. So you bring up a really good point. Although it's been a very successful program to keep people housed, we need solutions for long-term affordable housing. Thanks for that. Are there any other final comments? We'll have a chance for discussion and questions at the end, but thank you so much for sharing about your conversations in your group. Anything else? Okay, great. Well, if you'll bear with me, I will run through the last of my slides and then open it up for questions and comments. So, yeah, and thank you for listening to me speak so much. I hope it's been interesting, and I will try and get through the last heady bits here. So I also want to mention that COVID-19 happened during the course of this project, which was not expected, and obviously was an important aspect of the project and access to housing. So in March 2020, the COVID-19 pandemic changed the nature of our daily lives for what was first expected to be a few months. Now, at the end of 2021, we continue to navigate COVID-19 and adapt to a life during a pandemic. While COVID-19 pandemic affected the lives of most, it also highlighted pre-existing societal inequities, as some groups were more at risk of contracting the disease or faced a greater burden as a result of the public health protocols. The COVID-19 had 4 broad effects related to the intersection of women who experienced violence and access to housing. There was increased isolation and fear of contracting COVID-19 put women more at risk of experiencing violence. There was an increased risk of poverty due to economic shutdowns and further limitations on available shelter and housing options at first. The need to use alternative service models by many women, by many violence prevention services meant that a lot of things were happening over the telephone or over Zoom, which made it more accessible in the case for some women and less accessible depending on people's access to those things. And it increased awareness and focus around women fleeing violence in Canada and potentially created a window for policy change and further funding, which we've seen more conversation about this issue. So part of the report goes into our research and comments on how COVID-19 impacted our research and these issues in general. And next, I'm going to just talk about the policy recommendations. Again, you can see them in our report and get a full explanation about each of these recommendations. But I'm going to take a little bit of time here to highlight them. So these recommendations are overarching recommendations for change needed to decrease barriers to housing for women experiencing violence. There are 5 policy areas that need to be addressed, and those are increased housing supply, cross-sector organization, increased funding, reduced systemic barriers, and increased inclusion and accessibility of housing. So those are the 5 areas that we focused on, and within those we had 8 specific policy recommendations. And each pilot site established through the Getting Home project identified key recommendations based on the nature of the individual projects. And each recommendation reflects an issue that must be addressed in order for there to be meaningful and systemic change to occur. As highlighted throughout this report, the connections between policy areas have to be considered. As such, these recommendations work cohesively to address an intersection of housing and violence and provide a call to action for decision makers to address historical and ongoing inequities. So the first policy recommendation is increased supply of appropriate and affordable housing for women and their children who have experienced violence. There's an immediate need for more housing to reduce the bottleneck within VAW services, and the ability to secure long-term housing has perpetuated a cycle of violence against women and their children. The need for housing is province-wide and uniquely experienced based on location. The second policy recommendation is to create cross-sector organization to ensure adequate data collection related to women experiencing homelessness and the ability for knowledge sharing. Women are likely to be part of the invisible population of those who experience homelessness, which has resulted in an inaccurate estimation of how many women experience homelessness in our province. Policy recommendation number 3, establish long-term funding to violence against women services and housing services. There is a need to increase long-term operational funding for violence against women services. Funding for existing programs have proven to work in reducing homelessness and should be increased. Policy recommendation number 4, reduce social inequities women face that make them at risk for experiencing homelessness by reducing the gender wage gap. Long-term economic security for women will help prevent women experiencing violence, homelessness, and allow women to have greater choice in their living circumstances. Large-scale systemic barriers have to be addressed in order for equitable access to housing to exist. Policy recommendation number 5, reduce social inequities women face that make them at risk of experiencing homelessness by creating specific government support programs for women experiencing violence. The provisions of CERB during COVID-19 pandemic has broadened the possibility of governmental economic support to a targeted population. As a result of the pandemic, there is currently a policy window for innovative initiatives to support those who experience violence. There's a call for increased financial support to those who have experienced violence from the final report of the British Columbia Expert Panel on Basic Income, which I recommend checking out. It's a great example of a targeted policy that we can implement. Policy number 6. Policy recommendation number 6. Formally recognize the NOS as merely guidelines and create new standards to guide occupancy rates in social housing and the private rental market. We talked lots about that. Number 7, increase public transportation options in rural and remote areas. Increased accessibility to public transit will reduce the violence women experience in rural areas and also increase access to violence against women services. And finally, policy recommendation number 8, diversify the design of affordable housing to accommodate families and increase accessibility to units. Flexible design and diversified layouts will help address the severe lack of multi-bedroom units throughout the province. Those are our key policy areas. We have more information about all of them in the report. I recommend you check them out. So finally, I just want to talk a little bit about what's happening next. And we have some key next steps. So the research that Alina started interviewing women who had experienced national occupancy standards and accessibility to housing due to the large size of their families. Her research will continue, and she's going to be conducting qualitative and quantitative analyses of the experience of women in Vancouver compared with women in Toronto. And the city of Toronto has different standards that they use for eligibility requirements. Their standard is 2 people per bedroom. Simple, that's it. So we want to look at what the differences are and what the experiences of women are. As well, we are going to embark on research and producing a toolkit that looks at women-centered design for long-term housing. So understanding some of the design solutions of adaptable and flexible housing design that could allow families to live in their homes in different ways, as well as change the bedroom layout of their homes based on their needs as they change. So that project will be starting as well soon. And finally, we are about to embark on the Keys to Home project, which is a project in partnership with BC Housing, BC Nonprofit Housing, and Co-op Housing Federation of BC. Once again, we are funded through the Community Housing Transformation Fund. And the goal of this project is to build capacity within BC's STH membership for those of our members that are expanding their mandates or hoping to expand their mandates from being temporary shelter providers to providing long-term housing options for women. and this project will start in 2022. And we're really excited about being able to partner with BC and PHA on this, as they have so much good support and training already on a lot of these issues. So I've covered a lot of information. I want to open it up for questions at this point, questions and comments or any thoughts you have. We have about 10 minutes left before we close the session. But on this slide, you can see my contact info. Feel free to reach out to me if you'd like to talk about anything that I've mentioned here today, or need access to any of the things that I mentioned. So thank you so much. I will encourage you to take yourself off mute and ask any questions that you want, or Courtney, if there's anything that's come up in the chat, feel free to let me know, and I will stop sharing my screen now. Great. Courtney, were there any questions or comments in the chat that I should address?
I'm just doing a quick scroll. There is not, I will type out Tanis's.
And I'm just putting my
Perfect. Putting your email in the chat.
Would anyone like to share any questions or comments by taking themselves off mute?
I'm also happy to read them out loud if people aren't wanting.
Hi, this is Andrew from RentSmart. One thing you mentioned with the bottleneck that people are experiencing, the challenges of being able to move out of transitional housing. I'd presume you're also then experiencing a bottleneck for people who need access to transitional housing. And was there an aspect of that was part of the project?
That is correct, that we do see in our sector that there's a bottleneck for women accessing services as well as moving through the services to affordable housing. This project didn't focus specifically on that aspect. However, we do work on that at BCSTH, and we actually conduct a 24-hour census that was just conducted yesterday for this year, but is conducted annually to get a sense of a one-day snapshot of women's access to services and how many women are able to access services. And I don't know, there's several BCSTH team members here right now, so I'm curious if any of you want to speak about that aspect of our work.
I'll jump in, Tanis. So thank you so much for the presentation. I work with Tanis, but it was still thrilling to see. So I'm Amy at the BC Society of Transition Housing. I've been working with Tanis on this project for a while, and I actually had the good fortune to write the grant and work on the grant with the previous colleagues here. And part of the idea behind this, Andrew, was the recognition by our member programs that because women couldn't transition out of transition houses into safe, affordable, and long-term housing, that we were just having a bottleneck, right? The houses were full. They were spending the majority of their time trying to find housing for folks as opposed to safety planning and all the other wonderful frontline work they do every day. And it was in a funding stream that WAGE had at the time about building strategic and new community partnerships. It was equating economic sort of stability and we equated it with housing stability. So it was sort of partnerships so it was really great for us because it made us think, okay, who needs to be at the table to solve these issues? And those were the partners that Tanis highlighted. So from the day one of the project, BC Nonprofit Housing Association jumped in, and we had worked with them on another project about reducing barriers for immigrant and refugee women coming into transition houses. So, and then the Co-op Housing Federation jumped in because they had a project that it was specific for women who were trying to come into co-op housing, but were having struggles with the co-op share fee. So they had a domestic violence relief fund, but they didn't quite know how to connect with our sector. So they jumped in and we built that partnership, and then BC Housing jumped on board. So it really was this collaborative partnership that was the sort of the essence of the project in terms of really finding real solutions. And Tanis, when I remember when we first, they got access to the first co-op housing unit, we all put together like this welcome basket, and we sort of in a cynical, joking way said, we're solving the affordable housing crisis in BC one unit at a time, but that was sort of the heart of this project, was like, let's get real, because our members are doing such important work, but it's just another task put on them in terms of what they do on a daily basis. And they have an amazing skill set, but they're anti-violence experts, not housing experts, right? So it's to assist with that conversation. Yeah. Thanks, Tanis, for all this wonderful work. There's lots of great accolades in the chat box too. So thank you.
Well, thanks, Amy. And thanks, Andrew, for that question and comment. Anyone else? Any thoughts or comments?
There's a question from Kathleen that she's curious about the method used by organizations to network broadly within BC to reach out to one another for collaboration, problem solving, and advocating, and how easy / hard is it for organizations to find each other. Sorry, I've got some pets in the background who are also contributing to the conversation. So.
Yeah, I mean, we found that there was a lot of goodwill and interest in partnership across sectors, and that it just required some facilitation and networking to bring these projects to fruition. But there are lots of other partnerships that are hopefully happening, and we expect will happen because of the need that we know is out there. Transition houses know that this is a need. The housing sector knows this is a need. The general public is starting more and more to understand this is a need. So we found that there was a lot of goodwill. We created a website called Tips for Housing Providers, which hopefully points folks in the direction that they need to get more information. And of course, we are happy to facilitate those connections with folks that they're interested in working in the transition house sector. Housing Central is a great place for the conference that BC&PHA runs, is a great place for networking and opportunities for partnership. And our annual training forum in October is also a place where our members can get together and hear about these topics and meet with each other and folks that want to partner.
Awesome. Then a question if there's any plans to present this report in other sectors.
Yeah, well, I did present at Housing Central a couple of weeks ago, so that solicited some interesting conversations with folks that were in the room, which is great, and just been invited by CMHC to present to their community of practice as well. So definitely planning to, this project really focused on partnership with the housing sector and was a very outward facing project in that regard. And so wanting to make sure that the housing sector in general, from CMHC down to individual housing providers, are aware of the work and how they can play a role in solving these problems. And then the Keys to Home project will focus more internally within our own membership to help build capacity for those partnerships or the next steps of housing work to be successful moving forward. So yeah, and if anybody wants me to come speak to them or to their organizations, or has ideas for where I could peddle this, I'd be more than happy to do a presentation, at any length of presentation.
Dennis, do you want to talk quickly about the CMHC, the new funding for folks? Just quickly so that it's on their radar? Yeah.
Sure, yeah, I just met with CMHC last week, and there are 2 new funds through their co-investment strategy that members of that are providing shelter for housing and shelter for women fleeing violence, both Indigenous and the general population can apply for. And those are just being launched right now. So I don't want to get into too many of the details because we're just at the end of the session here. But if you're interested, let me know and I can pass on the information that CMHC shared with me and connect you with those folks. They're quite large funds looking for projects to fund across Canada that can support housing for women. Okay, well, we're at the end of our time. I'll let Courtney wrap us up. And thank you so much, everyone, for joining. An hour and a half is a lot of time to take to listen to me talk. So I really appreciate it that I could share with you today.